Hello, Dr. Chudi of Snowspirations, Global Health Solutions. So I needed to address the concern about becoming pregnant and having a baby even when you're not bleeding. So is it possible for a woman to become pregnant and have a baby without bleeding? Now the answer is yes, it's possible. There are some tiny percentage of women who might not be having regular bleeding, regular monthly bleeding, but they are ovulating. So the common denominator, the commonest thing, the standard that will lead to pregnancy is ovulation. Now, in some women, they might be ovulating, but they might not be bleeding. And in some other women, they might be bleeding, but they are not ovulating. There are actually a couple of different age groups that might experience this. Now, the very first period in a girl's life is called menarche. In some girls, if they engage in sexual intercourse before that first period, they can become pregnant. Now, you need to understand the logic, the medical logic. Remember what leads to bleeding in a normal reproductive cycle. In a normal lady that is experiencing everything, the hormones are pretty good. Remember what leads to bleeding. Bleeding is a consequence of failure of pregnancy to happen. Now, before pregnancy, there are hormones that makes the cover of the womb ready. The cover of the womb is called the endometrium. Now, if pregnancy happens okay, everything will go smoothly. That embryo will come back and implant in the womb on the endometrium. Now, if pregnancy doesn't happen, the cover of the womb, which is called the endometrium, will break down. So it's a cell, so the cells will break down and the blood vessels will be ruptured and blood will flow out. This is what happens to your menstrual bleeding. If you have an ovulatory cycle, there are some women that will be bleeding, but that bleeding is not ovulatory bleeding. Ovulatory bleeding means you are ovulating and you are bleeding. Some other women, because the body is somehow independent of each other. So whether pregnancy happened, whether you're ovulating, the cover of your womb by default will start getting ready. So the body of a woman is structured in such a way that every cycle a woman can become pregnant. So anytime you're releasing your egg is an opportunity for a sperm to meet the egg and become pregnant. And anytime, if you're still within your reproductive cycle, you are bleeding, that's a failed pregnancy. So in that population of women who can ovulate without bleeding, they can become pregnant. This can happen especially to a new mother, a newly delivered mother. She might be waiting for her period to come back, but she won't know she has ovulated, and she might be meeting with her partner, and she can become pregnant as early as few months after delivery of her child. Now, also, before a girl experiences the first bleeding, she can become pregnant. So this is where you need to be very careful. Now, there are also some women that have so many other problems with their reproductive system, and inadvertently, they are not bleeding like every other woman out there, but they've had all their babies. So we've actually had a case of a lady that had all her 5 kids without bleeding. So there are so many things that go on in the body of a woman. Our duty is to understand that no matter what happens, whether you're bleeding or not, if you want to be a mother, if you want to be a father, keep on making love. Unfortunately, some people focus on that bleeding. Oh, doc, I'm not bleeding. What can I take to make sure I'm bleeding? Bleeding is part of it, but it's not really necessarily a criteria for you to become pregnant. Thank you so much, and I hope you're loving the group. I hope you subscribe. I hope you're following. I hope you're doing everything possible to become a mother before the end of next year. Okay? God bless you and enjoy your day. Bye-bye for now.